Okay, my name is Britton Carr. I'm a junior nursing student here to check you off on the ears, nose, and throat on September 29th.
Okay. I'm Suki Hoffman, and I'm going to be checking out your ears, nose, and mouth. Okay, so from here I can see that the patient's ears are symmetrical, they're appropriate size for the head, they're pink, and they match the skin tone. So we can see if there's any tenderness here. Nope. Okay. So the tragus on both sides and the lobule are palpable, and the ears appear to be free of lesions. There's no apparent drainage or edema. If I'm going to look down this side, actually, the external ear canal, you can see, is free of any excessive drainage. There's no lesions and no swelling or masses. I'm going to look at your ear, if that's okay. Okay, and I would usually do this on both sides, but for the sake of time, I'm just going to do one. Okay, so this is on. So I'm going to put it in before I look into it to make sure I'm not stabbing you too much. Okay. Alright. Oh, cool. Okay, so there's no major exudate or anything in there. The tympanic membrane is kind of a pearly gray. I'm pulling his ear back and up. If it was a child, I'd pull it down and back. Sorry, I'm going to go back in there. Since we're on the right side, I can see that the cone of light is present at the 5 o'clock position. I can see the umbo, which is the long handle of the manubrium, and I can see the short process as well. Let's see. Okay, and I can see that the pars tensa and pars flaccida, I don't know how to say that word, are present as well. And if it was on the left side, I'd be looking for the cone of light at the 7 o'clock position. So I'm just going to throw the trash here. Okay, so to test the gross hearing, I'm going to have you cover one side, block the hearing, and just push it back and forth. So I'm going to whisper 3 words to you. You're going to tell me if you can hear it. Okay, so.
What? Cat. Bird. White.
Okay, cool. So that's to test gross hearing. And that's, again, I do that on both sides. I would do the Weber test, and that's to test bone conduction. So I'm going to put this in the middle of your head, and you can tell me whether you can hear it better on the right side, the left side, or in the middle. Okay.
Middle.
Middle? Okay. And then the last one is the Rhine test, which is timed. So I'm going to put this on the short process, or not the short process, on the mastoid process, and you're going to tell me when it stops making sound. Okay, and I'm going to time it. Here.
Yep. Yep.
Okay, so I didn't hit it very hard, but you could hear it through bone conduction for about 6 seconds, and then an additional 4 seconds for the air conduction. So a total of 10 seconds for air conduction. If I had hit it harder, it would have made a sound longer, so you'd expect to hear it a little bit longer. Okay, and that's to test the cranial nerve, the vestibulocochlear nerve, which is number 8. Okay, so now I'm going to look at your nose. It's right in the center of your face, which is good. Doesn't appear to have been. Have you ever had any breaks in your nose? Because it seems pretty straight. Okay, that's good. Yeah, so it seems symmetrical. Can you look up a little bit? Okay, so the nares are symmetrical as well, and the columella is 1/2 the width of the nares, so that's good. I'm going to look into your nose. There doesn't seem to be any major drainage or anything like that, no redness. So I'm going to move you up here, look in there. Okay, so the medial and lateral turbinates are present. It's pink and free of drainage. There's no ulcerations or lesions, no bleeding. Can I have you cover one side of your nose? Breathe in. Now Have the other side? Good, okay, thank you. So nasal patency is pretty good. I'm going to have you close your eyes. And can you tell me what this guy smells like? Does that look good? Okay, and then one more. Okay, good. So that's to test the cranial nerve number 1, which is the olfactory nerve, and so that seems to be intact. Did you have any pain in your nose? All pain. We didn't see any masses either, so that's good. No major blockages. Okay, I'm gonna put on one glove because I don't need two with this, and they're all gonna come crashing down, of course. Okay, so I'm just gonna look in your mouth right now, and since the patient's been talking, I can tell that the glossopharyngeal and vagus nerve are intact, but I'm going to look at them as well by asking them to say all in the mouth. Okay, so I can look at your mouth and see that there's a distinctive color and border between the lips and the facial tissue. Can you open up for me? Okay, so can you stick out your tongue? Look at the side. So because he was able to stick out his tongue, I could tell the glossopharyngeal, go back to that. Cranial nerve number, you can put it back. Cranial nerve number 12, the hypoglossal nerve is intact. And the tongue was pink and free of lesions as well. I'm going to put those away, I don't need it anymore. Can you open your mouth for me again? Cool. So the buccal mucosa is pink, it's moist, and there aren't any masses or lesions or ulcerations. The frenulum and the tongue are pink and on the midline. I'm going to grab a little press here. Okay, sorry, don't need that. Okay. Can you stick out your tongue again? Can you say ah? Okay. So the uvula is on the midline. And it rises with the soft palate upon phonation, and so that again confirms that the glossopharyngeal and vagus nerves are intact. I saw that your tonsils were present still, and they were not inflamed at all, so I would grade them at a 1+. And then can you just smile and clench your teeth? Okay.